Tashidelek, Namaste, and Vannakam to all. Unkalai mintam parpatu nallatu, which means good to see you again. I'm honored to be hosting this event in the gracious presence of our Honorable Director, Mr. Tashit Singh Pupila, and our distinguished experts, Dr. Nagendra from Siddha Medicine, Dr. Nagendra Babuji from Homeopathy Medicine, Dr. Dojer Abdullah from Tibetan Medicine, Chief Astroscience Practitioner Tsering Chenzumla from Tibetan Astroscience, and our dear participants from different parts of the world.
Professor Dr. G. Nagendra Babu pursued his Bachelor of Homeopathic Medicine and Surgery degree in 1995 from Karnataka University, MD from Maharashtra University of Health Sciences, Nashik. He is currently the HOD of Maitreya Medica at Shri Sai Ram Homeopathic Medical College and has more than 20 years of teaching and clinical experience in homeopathy medicine. Dr. Nagendra Babuji is the author of a book titled Comprehensive Study of Organon, which is one of the favorite books of all the homeopathic students worldwide. He was awarded the Best Doctor Award for exemplary contribution in the field of homeopathy in the year of 2012. He has also presented various national and international papers on homeopathy. Thank you. I would like to request Dr. Nagendra Babuji to kindly start your presentation, sir, please.
First of all, I thank His Holiness, and I thank Mensi Kang, the department, if I am pronouncing properly, for inviting over here and giving me an opportunity to share my views on homeopathic perspective of mental health and pandemic. Sorikpai is not my new platform. I had exposure to your medicine when I met Dr. Tenzing, Dr. Tirunarayan sir in our National Store Siddha, Chennai. We are well aware of each and every one. And thank you very much for inviting me. And I am the fourth speaker. It was indeed a good experience. I could see balanced auxiliary methods, as other systems of medicine call us. I am a general practitioner. Of course, I am a teacher in Sai Ram Homeopathic Medical College. And my journey in treating pandemic, COVID pandemic cases started as early as March 2020, if I recall properly. It was a panic period. I suggest the problem in handling COVID was for every auxiliary methods, it's more of the panic that is created in the media, as other speakers and all of you agree. Because when it comes to viral management, the disease of virus, I think Ayurveda, Siddha, Homeopathy, Unani, and auxiliary methods can handle it very properly. Example is the handling of hepatitis B. When it comes to handling COVID, as I said initially, and most of the speakers agree, COVID handling comes with handling of both mind and body, which makes it more holistic in approach, because the panic was associated. I call it as a panic rather than fear or something like created. The panic is created all around. The American Lung Association in the initial stages has divided the COVID pandemic into 4 stages. The first 2 stages are not so severe. 3rd and 4th stages are severe and critical. As far as OPD setup is concerned, outpatient department, we are allowed to treat, or we can handle it in the first 2 stages. Whereas the 3rd and 4th stages, we require a IP setup, or it comes under our parameter in handling COVID-19, though in the initial stages, the government of India did not allow us to handle the cases. But today the scenario has changed. In all stages of COVID, we have seen panic. I'll try to present a few cases from my practice also. Second perspective is classical homeopathic parlance. The COVID handling can be divided into so many segments. Whereas homeopathy treats COVID-19 in acute stage, because in acute stages, the pathology is so severe, the death of the patient can happen. So it's very severe condition. Second one is it falls under mental disorders. When it comes to homeopathy, given today's topic is mental health and pandemic, of course, this pandemic has really affected the mental health of the world, the entire world, I can say. So it's a pandemic. So mental stages or mental diseases in homeopathy, we divide them into 4 stages: somatopsychic, psychosomatic, acute origin, and doubtful origin. So I won't go to that level. Somatopsychic is when a patient is affected with a physical disorder, and if the physical disorder is incurable, obviously the patient loses his hope and he ends up in psychological disturbance. So somatopsychic. From the somatic sphere, it transferred to the psychic sphere. So I feel COVID falls under somatopsychic and acute origin. Acute origin of mental condition, until unless you find out a solution or you find out a treatment or his reports become normal, the patient cannot be recovered from his mental condition. Now, handling COVID cases in 3 levels we can divide in homeopathy. One is the prevention, which is very important when it comes to medical perspective. Second one is curative. The patient is affected, then what to do? The patient wants cure. Okay, we have to cure them with certain medicines which are available. For practical purposes, I have taken remedies accepted by WHO and Ministry of Health India. I will try to present few cases also here. And third one is post-COVID complications. So handling of COVID can be divided into 3 segments or stages: preventive stage, curative stage, and post-COVID complication handling. When it comes to preventive in India, as far as India is concerned, the WHO and the Ministry of Health has recommended a medicine called Arsenicum album 30 potency. The 30 is the potency. The posology here is the patient will take a single dose every day morning consecutively for 3 days, and this can be repeated every 15 days or monthly once based on the physician's decision. Now here, even as I said, every stage of the COVID-19, preventive stage or curative stage or post-COVID stage, when the patient recovers from active COVID illness, everywhere the mind has to play a major role. Mind is playing a major role, and a panic is there in the minds. If I recall properly, May 2020, I got a phone call. I was not seeing patients directly at that time. I used to fix phone consultations, and I used to send the medicines by courier, or the patient's kith and kin will come and collect the medicines from my clinic premises. Now this lady called me. She wanted to speak to me personally, and I spoke to her. And she said, "Doctor, I developed a throat cancer. For 15 days, last 15 days, I have been vomiting blood. Whenever I brush my teeth, whenever I try to gargle my throat, or whenever I try to shout, blood is coming out. I got cancer." I said, "Who told you it's cancer? It's only 15 days since you have been having it." She said, "I know, I want to consult." But anyway, by her force, I made a consultation, and she came in person. And after proper case taking, I came to know that out of fear, to prevent herself from getting COVID infection, government of Tamil Nadu was recommending Siddha medicine, Kabasura Kudiniru. Tirunarayanan sir, pardon me. And she took this 4 times per day, a full glass of it, daily for 15 days. And I think it was not the dose recommended. And she did this out of fear. She said, even if I develop mouth ulcers or ulcer, doesn't matter, I should not get COVID. Okay. And she believed in Kabasura Kudini, no doubt, but the dosage was very bad. And I had to counsel her. Dr. Dorji was telling all we need is counseling and getting the faith of the patient. That is important, especially in COVID. Education, like our Abdul Kalam sir says, education is the only tool India requires right now. So as I said, after good counseling and proper counseling and giving the proper dosage of Kabusura Kudineer, I added my medicine arsenic alba. I converted her. Sorry, Tirunarayan sir. So I prescribed arsenic alba 30 and she is good now. And proper counseling and mask maintenance and distance, social distancing, everything were explained to her. So this is the thing I can say. In the preventive level also, we can have panic and fear, which are hypoxia, dyspnea, anosmia, fever, pain. These are the commonest things which happened, and the breathlessness or dyspnea was the main important symptom which the patient had. The medicines that generally I prescribed in homeopathy, people who are interested, just for sharing with the platform. Aconitum Nepalis, the remedy is very good for fear. Fear of death, fear of sickness, fear of falling sick, fear of getting infected with the microbes. Everything you will find under this remedy. So to conquer the fear, we have prescribed Aconitum Nepalis and Arsenicum album, restlessness, a remedy for restlessness. The patient is so restless and he is also having fear of getting infected with somebody else. Okay, that fear of infection can be conquered with arsenic alba. Bryonia alba, Rastoxicodendron, Eupatorium perforatum, a good fever remedy and joint pains remedy. Ipecac cunha, Belladonna, and Gelsemium semipervorans. The drowsiness, the Gelsemium produces drowsiness. Gelsemium semipervorans is treated it was prescribed to a patient with cytokine release syndrome because it acts on the central nervous system. And in severe critical cases, phosphorus, chelidonium, veratrum viridae, iodum, camphora, China officinalis, lycopodium, arsenicum iodum, antimonium tartaricum, stannum metallicum, carbovage, and you people know another remedy, Justitia adatoda, and another remedy, aspidosperma. Justitia adatoda is a remedy. Israel homeopathic doctors recommended Justitia adatoda in a little diluted form, not in a concentrated form. When people started fearing to get vaccine, I hope most of you doctors would have come across this. Even I had to release so many videos in my YouTube channel to educate my people, my patients. 5 minutes video, I released it. Vaccine phobia was there. Everyone used to come. Doctor, I am having acidity. Can I take vaccine? People are telling vaccine has a lot of side effects. Okay, it creates intravascular blood clots and everything. Those people who have, I had to counsel them, and I had to prescribe some remedies which can prevent blood clots in homeopathy. Okay, and another thing people fear is some patients are taking treatment from me for diabetes and sugar purely with homeopathy. And now when they go for vaccination, they were fearing that drug interactions may happen because all these days they have been under homeopathic medication and suddenly they have to shift to allopathy or vaccination. The fear of getting side effects or drug interactions was raised. And according to WHO, neuropsychopathic symptoms developed in patients who had infected with COVID-19 or even people recovering from COVID active infection. They developed a neuropsychopathic infection within 90 days. So it shows even after recovering also the patient needs your help, needs your counseling, the patient needs your support. Anxiety, confusion, lack of knowledge about the spread of the virus, memory retardation, poor concentration, fear of death, all these things are the major problems that I came across, which I treated with homeopathy with a good success. Most of them are my patients or relatives of my patient. Okay, he has to have a routine daily life. Okay, he has to maintain his daily activities. Yeah, another thing I noticed in my practice is during this lockdown period, mood, and they used to get up at 8:30, 9 o'clock or 9:30, and most of them had their breakfast very late. So because of this late breakfast, of them developed, gastritis. And the pain in the chest, mid-sternal region, even they used to fear that they had lung infections and all. By proper case taking, we can analyze that and we can recover the patient. And second one is financial stress, loss of job. All these things have contributed a major problem in familial level and social level also. Okay, which we can only counsel, we can only help them, we can only guide them. Okay, so most of these things, social factors, I can say. So individual level, familial level, and social level, the panic was created, and this pandemic has affected the social life also. Like WHO definition of health says, complete mental, social, psychological, economical well-being is called health. So just treating the COVID case physically doesn't help us. Okay, we have to treat and maintain the balance. So holistic system does it. And last but not the least, we social workers, we were also under pressure. We are also in panic. And you can imagine the frontline workers who are facing the COVID patients would have had so many problems. The social stigma attached. In Bombay, one of the doctor was forced to vacate the house because he was working in COVID hospital. So these type of pressures were there. So the pandemic is still on. The waves are not over. So the fight is still on. So we'll have to be strong enough to maintain and recover the health of the patient in social, psychological, and physical, economical level. And finally, I end up with Buddha's quoting. You can't always cure, but you can always care. And that is what the hospitalization is. Hospitality is the major thing, and the Ayush departments will does it with grace. Thank you very much.
Thank you, Dr. Nagendra ji. And thank you for ending your presentation very beautifully with this line from Buddha. So I would like to thank you for sharing your experience through this very informative and enlightening presentation. And I don't know what Dr. Thiru has to say on your presentation.
Yes, okay, so I would like to listen.
It's, like thinking of asking Dr. Thiru Narayan ji about your take on Dr. Nagendra Babu's case regarding Siddha medicine.
Okay. In the first place, I completely agree with Dr. Nagendra Babu because I never encourage that particular medicine called Kabajara Kodini.
So there is a question for both Siddha and homeopathy doctors. According to Siddha and homeopathy medical system, which you mainly focus to boost immunity physically. So who will go first?
Seniors first. Yeah. As far as homeopathic perspective is concerned, telling immunity cannot be built, especially individual immunity cannot be built in a day. It has to start right from the beginning, like Ahara Vihara I was telling. The same concept goes in homeopathy. We call it as a constitutional therapy.
Yes.
Physic, mind, and soul. These three has to be strengthened. The COVID has to be handled in 3 levels: preventive, curative, as well as post-COVID. In preventive, arsenic alba I strongly support as recommended by Central Council of Research in Homeopathy, a body, governing body. Panic can be removed by arsenic alba because arsenic alba produces panic. That is homeopathy. If it produces, it cures. So arsenic alba has a capacity to reduce the panic, as well as arsenic alba has a capacity to remove the phlegm, the kapam, and everything from the body. So it is a supportive remedy when it comes to prevention as well as curative level. Vaccines, yeah, you cannot deny them. Vaccines have a good role. It is backed by a lot of research work. But as a doctor, we are supported with our logic. The diagnosis is a result of logic, not by knowledge. Okay. So when you inject a vaccine to a patient who is not, dietarily stronger or protein energy malnutrition. See, when you inject a vaccine to a person, the antibodies has to develop, and it is nothing but immunoglobulin. And the globulin element is nothing but protein. If protein sufficiency is not there in the body, the patient obviously cannot develop the potent antibodies to fight against the antigen, right? So it is the doctor's decision. That is why physician's decision is final. So everywhere we cannot apply it. And to my students, every time I'll say, in my book also I've written, the allopathy medication is ready-made. Whereas auxiliary methods, you call it as Ayush systems, it is a tailor-made.
Namaskara, sir. Sir, my question is, in your presentation, I have seen that you do or you suggest sun therapy for the COVID patient.
Yes.
Yes, so my question is, do you suggest sun therapy for the COVID patient with high fever?
It comes to sunlight, like general, everyone knows that sunlight is having antifungal properties. So one of the complications of COVID-19 is mucormycosis, the fungal infection. It's being true. And one of the surgeon was criticizing in one of the video I have seen in social media. He's a surgeon from Bangalore. He's hailing from Bangalore. And he said that mucormycosis in India is rise because people started having steam inhalation frequently. Though I don't support it, I criticize it. Steam inhalation is one of the treatment for any respiratory infection we do, but it has to be done under a process. I'm not that much informed in this subject, but when it comes to yoga, Nasika Shuddhi is there, where the salted water is poured from one nostril and removed from another nostril for Suddhikarana, the cleansing process. But after the cleansing, the patient has to sneeze it out. The Chitkari Pranayama something methods, he has to drain the water out. So only when you do the process perfectly and completely, it cleanses your tissues. Right, I hope. So sunlight has, as Doctor was telling, Narayan sir, sunlight gives exposure, it gives vitamin D, and it is good for fungus infection also, and it dries the tissues. Sir, I'll say one thing here. In homeopathy, we have different sources of medicines. We have medicines from plant, we have medicines from chemicals, we have medicines from animals also. There is one more source called as imponderabilia, where natural powers also used as medicines. Sunlight, moonlight, the magnets, the north magnet pole and south magnet pole, all these things can be used as a medicine in homeopathy. There is one more section.
Thank you. So the last question is from Dr. Tempa Kinzom, and the question is for all our doctors, the speakers. The question is, which food and fruits did you suggest to your COVID positive patients? So again, maybe senior wise.
I've been suggesting like 3 stages I'll divide: preventive, curative, and post-COVID. For preventive purposes, as I said, a regular staple food, since it's being a respiratory problem initially, of course it comes to multi-systematic later. So initially I'll ask and encourage all patients to brush their teeth morning and night without failure, and salt water gargling with a little amount of salt in a full glass of water, and that has to be maintained regularly. If the patient is affected, okay, with COVID, so bland diet, any bland diet, depending upon the area. As far as Chennai is concerned, as doctor was telling, boiled rice, idli, idayappam, the same kind of noodles kind of thing, boiled ones I recommend. I restrict everyone to stay away from fried items and sweets, because it can be harmful to the throat and tough to digest. And soups can be encouraged, especially vegetable hot soups. Post-COVID, I recommend them to go for sprouts, because a lot of tissue damage will be there. The patient has to go for sprouts, and I encourage them to go for papaya. These are the things I generally recommend.
Thank you, sir. So on behalf of my department, I would like to present a short thank you note. So as we have, doctors and participants from different parts of the world, so I would like to share with you all that Dr. Narayanan ji has been associated with us since the second Body, Mind and Life conference, which was held in 2014. So, and we would like to thank Dr. Tirunarayan for always showing his support to SOA ecosystem of medicine. It was because of him that the 11th Body, Mind and Life Conference was held at National Institute of Siddha Medicine, Chennai. And it was also because of him that we came to know a very good homeopathy doctor, speaker, Dr. Nagendra Babuji, who was introduced to us by Dr. Tiru. And he was also the speaker for 11th Body, Mind and Life Conference. So it has always been a pleasure working with both of you, and we look forward to more collaborations with you in future as well.